Hearing loss. What are the causes and adaptations of hearing loss? How we hear. Sound causes the eardrum to vibrate through the stirrup bone and transmits vibrations through the oval ear. Then they move through fluid into the cochlear, where hair cells send the vibrations to the brain, and they are interpreted as sound. Mild hearing loss ranges from 26 to 40 decibels, and it could be hard to hear conversations in noisy places. Moderate hearing loss ranges from 41 to 50 decibels, and it's hard to hear conversations without a hearing aid. Moderately severe hearing loss ranges from 51 to 70 decibels. Severe hearing loss ranges from 71 to 90 decibels, where people with this type of hearing loss mainly rely on lip reading and hearing aids. Profound hearing loss ranges from over 90 decibels. These people mainly rely on lip reading and American Sign Language.
One, two, three, four, five, six, seven.
Aha! You're on my apartment building on Granite Avenue. You owe me $300. Get it up?
Fred, take it easy. It's only a game.
Wilma, I'm just like them big tycoons. I play to win. Now, Barney, pay up or get out of the game.
That's one down and two to go. Betty, it's your turn.
I don't have any more money either. You got it all.
Then I'll take the mortgage and your open toe. Well, come on, shoot the dice, will you? Don't just sit there like a dummy.
I will not have you talking that way to our guests. Come on, Barney. I think we'd better go home.
Common causes of deafness. Common causes of deafness in adults. Old age, medication, long-term exposure to loud noises causes in kids, heredity, infection during pregnancy, trauma, and glue-like fluid in the ear. Noise induction hearing loss. Noise damages small sensory hairs in the inner ear that help transmit sound to the brain. Jobs that can contribute to this type of hearing loss. Musician, construction, farmer, armed force. These jobs all deal with loud noises every day. The treatments are hearing aids, generators, counseling, cochlear implants, medications. This type of hearing loss happens over time. Conductive hearing loss. It's caused by a disease or an obstruction, and it affects all frequencies of hearing. Causes: wax infection, hole in the eardrum, glue ear, trauma, ear surgery. Conductive deafness is hearing loss or impairment by a defective part of the ear that conducts sound, specifically to the external canal or the middle ear. So this is caused by anything that can block the ears, like earplugs. Sudden sensorineural hearing loss. This is a rapid loss of hearing all at once or up to 3 days. The causes are infection, abnormal tissue growth, circulatory problems, trauma, toxic causes, neurologic causes. This is basically a rapid damage to your nerves in your ear. Sensorineural hearing loss is caused from damage to the sensorineural hairs in the inner ear or the nerves that supply it. It affects mild to profound hearing loss, but can affect certain frequencies more than others. Causes is age, Meniere's disease, loud noises, trauma, ear surgery, and infectious disease. Hearing loss in older adults. It's very common. They start to lose their hearing with age. 1/3 of people older than 60 have hearing loss, and half of those are older than 75. Most hearing loss happens in the later years of life, and most of it is heredity. Some causes are heredity, jobs, a virus, bacteria, heart condition, stroke, head injury, tumor. Tinnitus. It's a ringing, roaring, clicking, hissing, or buzzing in the ear. The sound can be loud or soft, high pitch or low pitch. It can be in both ears or one ear. It's a symptom that is saying something is wrong in your auditory system. Tinnitus can happen like right after a concert ends. The musicians would have ringing in their ears for a while after the concert, and it is the ear saying that something's too loud and it wants you to get away from it. Causes: earwax blocking your ear canal, sinus or ear infection, Meniere's disease, brain tumor, hormonal changes in women, thyroid abnormalities or loud noises. Meniere's disease. It's a disorder in the inner ear that causes dizziness, a feeling of fullness or congestion in the ear, ringing in the ear, and hearing loss. Causes are buildup of the inner ear. The buildup interferes with normal balance and hearing losses between the inner ear and the brain. It's diagnosed by 2 or more episodes of vertigo, which is dizzy spells, that last at least 20 minutes. Dizzy spells can last for a few minutes or up to all day. Treatments: there's medication, salt restrictions, and diuretics to help with the dizziness. Other dietary and behavior changes, therapy, injections, pressure, pulse, treatment, and surgery. The surgery is basically to get the buildup out of your ear. Ear infections. It's an inflammation of the middle ear. It occurs when fluid builds up in your eardrum. 1/3 of kids will have at least one ear infection by their 3rd birthday. Kids are more likely to get an ear infection because the tubes are smaller and more level in adults than in children. Pendier's syndrome. It's a disorder that causes early hearing loss in kids. It also affects your thyroid gland and balance. It can happen from birth to 3 years when it begins, but can get worse after that. You can lose your hearing suddenly, and it will sometimes be restored after. Most cases are bilateral hearing loss, which means it's affected in both ears, but one ear can be affected worse. Otosclerosis. It's an abnormal growth of bones in your middle ear. It interferes with sound in the inner ear. Its causes are heredity, hormonal changes with pregnancy. The symptoms are hearing loss, dizziness, balance problems, and tinnitus. It interferes with the sound wave going through the ear, and it can be treated with surgery, but it may worsen your hearing. Hearing aids, they are electronic devices that can help you hear better. A part of a hearing aid is placed behind your ear. There are 3 styles: behind the ear, in the ear, and canal. There are 2 types of them: analog and digital. All hearing aids depend on the severity of your hearing loss. Behind the ear fits behind the ear, and it's used for mild to profound hearing loss. These are the only types of hearing aids made for profoundly deaf people. In the ear canal. In the ear canal fits all the way inside the outer ear. It is used for mild to severe hearing loss. It is not normally worn by kids because they would have to get new ones every time their ear would grow. Canal. There are 2 types. In the ear canal, hearing aids are made to fit the size and shape of your canal. Completely in the ear canal, hearing aids is mostly hidden by the ear canal. Both are used for mild to moderately severe hearing loss. These are small and difficult to remove or adjust, and you have to remove them to take a shower, go to bed, go swimming. They have limited power and volume, so they are not recommended for kids or people with profound hearing loss. Analog. They convert sound waves to electrical signals, and then they are amplified. They are built to the user's needs, and they have different settings and can be changed for different environments. They usually cost less than digital, and they come in 3 styles. Digital, they made sound waves into numerical codes, and then they amplify them. In the codes, they have information about the pitch and loudness. That is why they cost more. And it can be programmed to amplify some frequencies more than others, and has more flexibility to fit the user's needs. And they also come in all 3 styles of hearing aid. Cochlear implants are complex electronic devices that help people with severe hearing loss or profound hearing loss to hear better. There is an external part behind the ear and an internal part that is surgically placed under the skin. They do not restore normal hearing. Signals are generated by the CI are sent to the auditory nerve, then sent to the brain where it is recognized as sound. Some CIs don't work on people, and so it's not an option for everybody, and they'd have to throw the CIs away after that. American Sign Language, it's not a complete language. ASL uses facial expressions, body, posture, and hand movements. No sign is universal. Every country or region has their own sign. The only sign that is universal is I love you. English and ASL are completely different. They have different signs, different word order, and pronunciation and grammar. In ASL, you'd say hi, name, me, Nicole, meet you, nice, instead of hi, my name's Nicole, it's nice to meet you. And they have some signs that mean two things, like nice, clean are the same signs. How loud is too loud? Green means no harm to hearing. Yellow means harm to hearing if you are around it for a long period of time. Red means permanent damage to hearing. 0 decibels, the smallest sound that a person with normal hearing can hear. 30 decibels is a whisper. 70 decibels is a dishwasher. 85 decibels is noise from city traffic. 90 decibels are noises from a lawnmower. 95 decibels is a motorcycle. 110 decibels are concert speakers. These can damage your ears permanently within a minute. 120 decibels is an ambulance or fire truck siren. 140 decibels is a jet engine at takeoff. And 150 is firecrackers or shotguns.